Moving on to our first panel. Our first panel will cover the impact that the arts and culture have on health and well-being. So I'd like to hand over to Professor Frank Finley, who's going to chair this panel.
Good morning, everybody, and welcome. I thought our three speakers really have teed up today's programme and events really wonderfully, and I'm not going to kind of rehearse the important points they made. There's been mention of the parliamentary report, which is well worth a read if you haven't seen it already. So we're going to be looking in this first session the impact of arts and culture on health and well-being, which is framed as a question. I guess one thing that is increasingly associated with the health and well-being agenda are issues around mental health. Mental health, as a recent report of the Arts and Humanities Research Council pointed up, accounts for something like 20% of the total disease burden in the UK, which exceeds cancer and cardiovascular disease. And it's one of the main reasons why people have to take time off work. It's an issue which even in university life we're encountering in an ever greater degree, and I suspect we might touch on some aspects of that in the following session. What I'm going to do simply is allow the focus on our speakers and introduce them quite swiftly. Our first two speakers, first up, are my colleagues Freya Bailes and Karen Burland from the School of Music. Freya is one of our university academic fellows, this is a group of people we refer to as great minds, have been recruited to inject new impetus, to bring new disciplinary specialisms to the university. Freya is a music psychologist, and she's been involved in a number of interdisciplinary projects relating to music and well-being, and has recently developed a new postgraduate program in that particular area, which is going to be welcoming its first students presently. Karen Burland is head of the School of Music, associate professor. Her research interests are in musical identities and their role in musical participation in a variety of contexts, and that looks at music in therapeutic settings. So if I could invite you please to come up. Thank you.
Thank you, Frank, and it's great to be here. For those of you who don't know us, that's a wonderful introduction, but I'm Freya, and this is Karen, and we're going to share this presentation. And so we're asking really a very large question here, the impact of music on well-being, how, what, for whom. So a ridiculously large question that came from a really, really small and specific starting point. It came from some Ignite funding from the Cultural Institute, for which we're extremely grateful, and in this particular instance it really did ignite a whole series of further questions, and I'm afraid today, I think it's fair to say, Karen, we're going to be mostly asking questions rather than necessarily answering any, which I'm sorry. No, I'm not sorry. It's good. It's good to ask questions, I think. So the background to this scheme then, the Ignite scheme, it's worth knowing that the purpose of this really is to, we wanted to use the money to develop a partnership project between the university and external organisations. In this particular instance, we decided to work with a particular music therapy charity called North Yorkshire Music Therapy Centre. And the purpose being to advance research impact and explore ideas and areas for development. So this we most definitely did. And the particular objectives that we had in this project were North Yorkshire Music Therapy Centre were really driven to have a better understanding of the context in which they operate in North Yorkshire. So a rural area where they're providing music therapy, in other words, music that is specifically designed to address therapeutic goals. But they were interested in other ways in which music might be being used therapeutically in different contexts, such as community music or in education contexts. So they really wanted to survey what was out there, which we were able to help them with. They also were particularly interested in recognising the challenges to accessing music therapy, as were we. So this was very much a point at which we agreed that it would be worth investigating. They, of course, were interested in grounding their work in development plans in research, but we were also really wanting to try and connect practitioners and researchers interested in the different benefits that might arise from just the very fact of researching the process in the first place, and we wanted to prioritise questions for future research. So our starting point was simply to do based research, just to generate a database of the different sorts of activities that we could identify in which music was being used somehow in some therapeutic context or in order to have some well-being effects. We were asking questions about the location of the provision, the type of provision, the status, so if it's a charity, any funding that these organisations have been successful in procuring, what were the different target groups, the age range, how frequent were sessions that were involving music, were these group or individual, were people being referred or were they approaching these organisations directly, and the number of service users to the best of our ability. So, am I handing over to you here? Over to Karen.
Cheers. Thank you and good morning. So what we did after this exercise is we, and we're in the process of doing more of this work at the moment, is we interviewed some of the people who we'd found through the database. So we've got a small number so far, but part of the work this summer is to kind of build that base of data. And what we've done is a kind of thematic analysis of the kind of things that the people we spoke to were reflecting on, about what it's like to work in the specific context of this very rural context of North Yorkshire, but also what it's like to work in the field of therapeutic music much more generally. So from this initial thematic analysis, we found 7 themes which related to the stated goals of the provision. And the most popular of these related to the social benefits and well-being outcomes. So I'll just go through some of these just to give you a brief overview of the kind of content of those themes. So the social category discussed comradeship, connecting and participating with other people, the way in which the musical activities allow people to make friends and actually allow them to increase the amount of interaction that they were having with other people in their lives. There were many explicit statements about how music activity was able to enhance well-being, that it provided a soothing atmosphere, it promoted relaxation, supported moments of transition and change, provided a way for people to live fully and creatively, that it supported quality of life, promoted healthy atmosphere, and helped people's understanding of the wider world too. In terms of mental stimulation and agility, there was definite reports of increased attention and focus, that learning was taking place through these activities, and that it enabled people to develop their memory capacity as well. There was a theme around physical mobility too, about maintaining and developing physical skills, about falls prevention, which we've already heard about from the first couple of papers, about promoting exercise, getting people moving. There's a theme there about confidence, about engagement in musical activities promoting self-esteem, providing a sense of purpose, boosting morale, affirming the self, and providing self-confidence. Of course, fun and enjoyment should not be neglected here, and this is a very kind of common outcome as well. It brought joy to people, a real sense of fun and, just having a really nice time with other people. And then the final category that we had was emotional, that engaging in musical activities encouraged emotional engagement, it helped to unlock emotions for individuals, and was a form of creative self-expression. In terms of the actual context of therapeutic work, the providers talked about how the service that they were providing initially emerged as the result of them and perhaps another person identifying a need in an area, a need for provision in an area that was familiar to them. And so as a result of this, I think that the individuals identified the importance of other people in the work that they do, not only in terms of having enough people to deliver the service that is needed, and the acknowledgement that actually there weren't enough people involved in their teams, and there was a really clearly stated need for more music therapists, more musicians, more administrative support. And then there was also, rather than just the day-to-day running of the organisation, there was a sense that organisations benefited from key people, often in influential positions. So urging them to apply for particular schemes of funding, providing advice on council boards. Other people were seeking support in writing grant applications, which is a core part of the business of therapeutic providers. They have to apply for funding regularly. And the networks also were seen as really important, but very difficult to sustain and nourish because of the demands on their time elsewhere. So building a network, but then sustaining that network is incredibly problematic. It might look from this slide that there wasn't much to say about the benefits about the provision. That's not true. I've already listed some of them. Of course, the providers identified a range of benefits for the people that they worked with, and it was really useful reminder for us to see that the families and the carers were benefiting as much from the interventions as the individuals themselves. Some talked about how it was music was offering a chance for individuals to find loved ones again, and explained the comfort that families took from knowing that their loved ones were being given opportunities to engage with music. One thing that I am going to come back to later is about evidencing practice, and actually this is something that came out earlier as well. The providers said that universal measures might be quite helpful, and actually there's some collective thinking I think that we need to do about what evidence looks like and how we measure the impact of what we're doing. What is valuable evidence, and how might we articulate that through funding applications? So moving on to funding. I've already said funding is critical for most of the organisations involved in providing music, and funding applications happen on a fairly regular basis. One of the suggestions that came from our interviewees was that actually it would be really helpful if funding could be offered for periods of over a year. You know, the typical practice that you get funding for a fairly short period of time. This would allow more effective planning, it would allow more space for work to develop, and would also presumably create more time for impact to be fully realised. And one of the difficulties with the constant cycle of funding applications was that each scheme wants to see how work is being developed and adapted, but what the new angle is going to be with the new project. So there's a kind of constant sense of we've got to do something a little bit differently this time to attract some more money. And the frustration of this is that if value and impact is demonstrated in one project, it is clearly addressing a direct need in a particular area, then having to make adaptations to meet the new funding criteria can seem a little bit counterintuitive. So we asked the providers about the challenges they faced in their work, and I've already mentioned this, but everyone said they felt understaffed, whether that was in terms of the actual practitioners themselves, other musicians, administrators. These kinds of things would vary depending on the context, but this created pressure and a lack of mobility to put in place the provision they felt would best suit the need in the area. One of the challenges of working in rural areas in particular is about access to provision. So for the providers, getting people out of their homes and into the community is really important, but the logistics of this are tricky. Public transport isn't necessarily a viable solution, and so there's relationships to build with community transport providers, and the organisation of this is a really heavy burden. Another provider said they have one volunteer driver, so if people needed it, they'd provide taxis because they just didn't have enough support within the organisation. Also in rural areas, there's significant distances to travel between clients. It can be as much as 45 minutes, which obviously has a significant impact on the amount of sessions which can actually be delivered in a day. Also, reaching the kinds of people that would benefit from community music groups could be really difficult. And this is another area in which other people play a really important role. Building relationships with care homes, other community groups, schools, that's one way in which the word is spread, but again has a time implication too. For the providers that work in care settings, the broader climate was also noted as having a significant impact on their work. Some people described care staff, the situations of care staff as demoralising, making it quite tricky to organise sessions, and so it's kind of again demonstrates the impact of having other people on board for kind of the success of music therapeutic projects. And then the final point here that someone mentioned in their interview was that it is possible to start a project and realise it's losing money. And that creates a particular tension because it might be fulfilling a need, but organisations have to be run like businesses. So there's a bit of a tension there about, well, you're doing a good service, but you're losing money. So what does that mean? And then the final thing from me is just to return to this point about demonstrating impact. The providers we spoke to were all able to identify a very broad range of ways in which they demonstrate and evidence impact through qualitative data, individual case studies, family records, videos of kind of pivotal moments, reports from family and carers. This is a routine part of any therapeutic practice. But it can sit slightly at odds with funding applications, which seem to value more quantitative approaches. One of our providers mentioned it would be quite helpful to have some universal measures. There are some that exist, of course, but I guess one thing we can reflect on is what might meaningful, comparable data look like that captures that richness of those qualitative reports, those qualitative insights that we have, but can also be recognised as a measurable and meaningful measure.
Thank you, Karen. So, as a result of this, or part of this project, we had some money to bring people together for a symposium, and we deliberately contacted those providers that we'd identified through our desk-based research to come together with researchers, students as well, for a day of sharing ideas, exploring some of the current challenges and opportunities that are available. And we reported the findings of our project so far. We had music therapists attending this day, community musicians, arts therapists, community artists, students and academic researchers, as I say. Having presented our research, we then had 3 workshops in the afternoon to bring these people together to focus on sharing current practice, directions for collaborative research, and challenges and opportunities for music therapy. So I'll just briefly share some of the findings or some of the things that were discussed in these different workshops. So the first, sharing current practice, we identified some of the current practices that were to do with entering therapeutic music practice in the first place, some of the positive dimensions of current practice and challenges as well. And I just want to particularly highlight here some of the things that I think are particularly relevant to the discussion today. First of all, the diversity of practice as being something which is particularly positive dimension of current practice, and also we are asking questions. This to us was particularly positive. And again, a challenge just to draw your attention to is the tracing impact over time, which in some ways relates to what Karen's just been mentioning, issues to do with evaluating and evidencing and tracing the impact that the work is having. The second workshop was led by me, and it's really looking at directions for collaborative research, and again, deliberately bringing into the room a real mix of individuals to try and ask what are the relevant questions here, where can we collaborate, what would be a good thing to do. The range of questions here really highlights, I think, the strength of the collaborative approach, understanding the wider context of music therapy work and how therapeutic music may have benefit beyond the moment for other aspects of health and associated support services. And I think it's quite clear that evaluation and measurement, again, creates pressure for practitioners. And the question we can ask ourselves is, what role can we as researchers play here? This group was also clearly trying to understand itself in terms of how it is perceived by itself and other stakeholders, and what this might mean for demonstrating impact around the benefit. These all seem very connected and are really important elements for the continued growth and support of the profession. I think I've skipped one. Very briefly, the final workshop was about really focusing in on, as I say, those challenges and opportunities for music therapy. Many of the things that arose from this particular workshop really echo those which came up elsewhere. So there were concerns here again about recognising and valuing a diverse range of approaches to therapeutic uses of music, and a clear desire for opportunities for collaboration in order to ensure that there's continued funding and excellence in provision as well. Concerns were around evidence, external understanding of the profession, and differences in practice and scope. And training was also a strong theme to emerge, particularly in terms of sharing ongoing practice and mentoring. So what we really took from this is that collaborating in this way with music therapists, community musicians, students and researchers was really beneficial as a means of generating useful, as I said, questions, lots and lots of questions for us. So what are we prioritising as a result of this, this ignited series of questions? So some of the key things that have emerged from this admittedly small-scale round of data collection so far are that external factors that are worth looking into some more to do with infrastructure around provision of service. So those elements that Karen mentioned to do with transport, connections between providers as well, and advertising services. Another external factor is really the obvious one, availability of funding. Contrasting funding priorities as well as a concern, continuation of funding and the term of funding. And then how can we measure and demonstrate impact? How can we capture that richness in numbers? And management of the business. So what will make all of this easier? What are different models of administration that could be explored? So the next steps then for us, well, we want to expand further the number of interviews to gain this richer insight, and develop the project, which we're in the process of doing to incorporate West Yorkshire as well. But I think really our main response has been to try and build and establish a music and health and wellbeing network for interested collaborators that really brings practitioners together with academics to explore some of these areas. And this is a network which we're proud to say we're going to be launching at a conference in November. I'll put the details up in a moment, in partnership with Nordoff Robbins, which is a big music therapy centre in London. So that's really exciting. Briefly on to acknowledgements, and to, I think, open the floor for questions or at the end. At the end, great. So then in that case, quick plug for our conference. I hope you can come. Thank you very much.
Thank you, Freya and Karen. As Freya said, we're going to take questions at the end and try and get a panel discussion going, so do save them up for them. I thought there was an awful lot there from that small pilot study. Issues around kind of the perspective from the providers, impact, collaboration. You mentioned also the carers. I believe something like 3 out of every 5 individuals in this country will be in unpaid caring relationships at some time in their life. I've had some conversations recently with carer.org, an organisation which supports carers, and they've tried to quantify the unpaid work that carers do, and they've come up with a figure that vastly exceeds the annual budget of the NHS. So I think there's some pause for thought there. Okay, moving swiftly on, and thank you for getting things off to such a great start. So we have Sylvie Forson and Milena Dragic as our next 2 speakers. Sylvie is Director of Artlink West Yorkshire, where she's been active for something like 15 years, and during that time has set up all sorts of different kinds of participatory arts projects, working with disadvantaged and vulnerable groups of adults, but also young people. These include adults with eating disorders, adults living with dementia, adults with long-term mental health issues, and women who are part of the criminal justice system, as well as young offenders. And I guess those are some of the areas of the vexed social questions, the challenge-led sort of approaches that we're looking to encourage that are encompassed by all those areas. And Milena is a multidisciplinary artist who's exhibited and performed nationally and internationally. She's worked with various groups in schools, in galleries, hospitals and community settings, and has used art practice and activities as transformational tools for over a number of decades. So I think the 2 of you are likely to give us some very interesting and complementary insights. So I'd please welcome you to come up to the front.
Hi, thank you for the introduction there. So, as already mentioned, I'm Sylvie, Director of Artlink West Yorkshire. We're an Arts Council national portfolio organisation, and we're based on Bellevue Road, which is very near to here, about 5 minutes walk away. So, as already mentioned, Artlink works with a vast array of marginalised groups of people. What I wanted to talk about particularly today was a 6-year big lottery funded project that Artlink's undertaken. We're in the 4th year at the moment. We've worked with over 200 adults with learning and physical disabilities, dementia and mental health issues. And this major project has given us an opportunity to really embed our work and to go more deeply into our practice of working with pairs of professional artists in often challenging settings. And if many of you know that funding to undertake longitudinal work like this in the arts is very rare. And we're really grateful to Big Lottery for recognising the impact which arts engagement can have on the lives of vulnerable people. So this is the Artlink building. It's an open day that we had. So every couple of years we invite community groups, local people, any contacts that we have into our building. Last year, I was privileged to undertake a Winston Churchill Travel Fellowship to New York and Vancouver. And the aim of what I was looking at under the arts and older people category was what methods of arts engagement are successful in enriching the lives of older people, and what evaluative and research models effectively capture this work. I visited 3 main organisations in New York, including Elder Share the Arts, which are a small charity similar to Artlink, working in intergenerational arts programmes. I also visited the Creative Centre. They work very much on a one-to-one basis with people with acute long-term health conditions such as cancer. And then I also visited the Museum of Modern Art and their Vast Access programme. In Vancouver, I visited 2 participatory arts projects funded through the Vancouver Arts Board at West Point Cray Community Arts Centre and the Roundhouse Community Arts Centre. In Vancouver, I also made contact with 2 academics. So one of them was Dr. Gloria Pervine, who's a postdoc research fellow funded through the Alzheimer's Society. And the other was Professor Alison Finney, who's an associate professor of nursing. This is just an image of the beautiful UBC campus. They both work in the field of dementia and use art-based methodologies to evaluate their work and engage with older people. My visit also coincided with our major 3-year piece of evaluation, which was undertaken with the support of Dr. Annie Raw. It was exploring the use of ethnographically based methods of evaluation to capture the progress and changes which were taking place in the people we work with. Many of the people we work with have very little verbal communication skills. This initial first 3-year programme of work was titled Get Started, and we wanted to look at outcomes under 4 key headings. So we wanted to see whether people reported feeling less isolated and socially excluded as a result of attending our workshops. We wanted to see whether they felt more confident about taking part in activities in their residential settings and outside of them. We wanted to see whether they reported psychological well-being that helped them to maintain their independence. And we wanted also to see whether they felt more confident about engaging with members of the local community. So when I talk about reporting, it's not that they necessarily reported about this themselves verbally. What we wanted to do was track the changes with the people we work with through a means of rich narrative and observation. So Annie initially supported us with a system of looking at detailed signifiers. So for example, we trained up a vast team, 14 artists, to look at changes in terms of were they having more eye contact with us? Were they smiling when we came in? Did they remember our names when we came into the session? Particularly myself, as I didn't always visit on a regular basis. These were all significant changes. Over time, in fact, we've used these prompts less and less because our artists have become much more familiar with this process of deep observation and narrative. The people that we work with don't integrate with the cultural life of the city, and to this end, we became involved in major events that were taking place at high cultural institutions, such as the Bradford Media Museum Wonderlab exhibition that took place last year. We also got involved in the Weather Cafe installation, which was created by Sky Award-winning artist David Shearing. We held a major event at the Northern Ballet rehearsal space, and we're going to do that again next year. Over 100 people with learning and physical disabilities, dementia, mental health issues attended for an incredible event and celebration that day. We've commissioned work for Light Night, and in collaboration and in response to the work that we're doing. So this is a sculptural piece by kinetic artist Jim Bond. We also made visits to the Leeds Art Gallery and explored the exhibitions that were taking place. We were involved in the British Art Show. We've also showcased work, held performances, and had commissioned animation pieces for the Beyond Festival in Leeds and the Words in the City Festival. We really felt that the people we work with should no longer be in silos and should be part and recognised of the rich cultural life of Leeds. Our 14 artists are still creating work and pushing the boundaries of artistic collaborations in conjunction with our people with learning disabilities. We've got a film event taking place at Artlink on July the 18th, which will showcase a commissioned piece of work in collaboration with learning disabled adults at the Neyburn Centre. and it's going to be a wired sculptural piece with animation projections onto it. We're also going to showcase some of our animation pieces. What we found time and again is to track the changes and to gather stories takes time, and that over the 4-year period we've demonstrated impact of arts and culture on the people we work with as a narrative and not a number crunching exercise. In a recent talk at the Arts and Health Symposium for the Cultural Alliance in Hull, Lord Howarth reiterated the need for paying attention to stories as well as measurable scales. In the 2020 WHO strategy, it noted that good health for communities is a resource and capacity that can contribute to achieving dynamic and creative societies. A couple of weeks ago, I attended the Winston Churchill Awards ceremonies, and Nick Danziger, who's travel photographer and previous fellow, talked about how his life's work had been about giving people a voice who didn't have the opportunity to be heard through his photography. And I feel that this is what Artlink does through the use of arts to engage people. What I've often found within the health sector is that there is a need for quantitative measures rather than the narrative measures that we've developed over time. And I think that there's a place for both of these in telling the rich story of what's taking place. What was affirming for me and reassuring on my visits to New York and Vancouver was that at the MoMA, Carrie McGee, the programme manager, had come to the conclusion that questionnaire-based evaluation didn't tell the story of what was actually taking place on their many access programmes. And for this reason, they'd engaged an anthropologist to help them with their evaluation. When I visited Vancouver, the 2 academics I spoke to used a rich system of ethnographically based evaluation to document their work. Dr. Gloria Pervin uses film to capture specific moments with adults with dementia engaging with music. She's currently developing another arts-based project in response to the talks that we had when I was visiting. And Artlink is currently developing a programme in response to the work that Gloria was doing over there, through funding from Time to Shine, using film to document the process of engagement with adults with dementia. This rich tapestry of exchange and ideas continues across the globe with the recognition that observation and slow observation, or slow understanding, is a key route to documenting the benefits of arts engagement on people who have little means of verbal expression. I'm just going to finish with a quote from our Year 1 evaluation report, which was a quote from one of our volunteers. It was one of the people who barely spoke and always appeared to be sleeping. All of a sudden, the poem was read. Was it Daffodils? And she began reciting, and this lady always had her head back and appeared to be sleeping. But after that experience, this lady became so much more engaged, and we were well into the project. It just triggered something within her. It was absolutely lovely. And there it was there. And I thought, this is wonderful. So I'm going to hand you over to Milena, who's going to talk a bit about one of the long-term projects that we've been developing with a group called Lilac, and we're going to show you a clip of the film of some of their work.
Hi. Sorry. Okay. Thank you. Will that bring the video as well? Okay. Right. I will talk you about the group of adults with some with learning disabilities, some with mental health problem. And I've been working, they meet once a month. I've been working with them intensively for over a year with a fellow artist, Georgina Buchanan, who's a mostly sound and music artist. I'm mostly visual artist with some movement and performance included. What I want to say is we are all aware that we need time to spend with this kind of approach. It's not a quick fix. Oh, we'll do the one workshop, or we'll do the month's worth of workshops, and then everything will be fine. For people like this is a long-term project that they need. They meet not necessarily often, once a month, but over the year, we have noticed that the confidence has grown. The people who found it difficult to go on a bus to Wetherby from Leeds are now travelling on their own to Manchester to maybe go on a course there. People who have extensively been smoking are now coming and saying to me, oh, I only now smoke 5 cigarettes a day. And but the evidence is anecdotal, and so what we are doing with ethnographic approach is bringing this anecdotal evidence in the kind of public domain. I am not an analyst in my job as an artist. I can only bring these moments and share it with people. Now it's for people like Sylvie who make application to Wellbeing and bring the funding. The funding has to be for long-term projects. It cannot be just for the one workshop here and then one workshop there, because that doesn't work. So with this, I'm going to talk about lilac, and we have some of them you might have seen in the previous slides. They meet once a month at Artlink, and we wanted to, because there are like problems, health problems, we wanted to include the movement and music. Now, as soon as the movement and music were introduced, there was a problem, because they were used to do the more visual arts. The visual arts they love. The movement and music they were a bit worried about. And what they were worried about was that it was childish. So in order eventually to, some of them were kind of quite accomplished musicians, and some of them did not want to participate in music at all. So in order, excuse me, in order to kind of break down this idea that things are childish, we took them to the Leeds Art Gallery and showed them the quite contemporary stuff, like Bruce McLean, I Want My Crown. If anybody has seen the video installation upstairs, and it changed them. They thought, actually we could do that. So we dance in front of in the gallery, in front of the Bruce McLean installation. And so we came back to Artlink and we sang, and we did our video piece. So, can we put the video? And there was joyfulness, and there was progress towards something else.
There were white doves flying above the waves. The air was calm and the sun was warm. In the distance they saw an island. The island was as pretty as 3 princesses.
In the middle of the island, there was a lake. Cold and still. In the middle of the lake, there were prince swimming. The doors were down. But the sand to watch him. The waves swam up from the bottom of the lake, pushed him onto the water.
The prince grabbed onto a kite and began to float into the sky. The prince flew up into the sky and he heard a sound. All the birds in the sky were having a party, dancing queen.
Thank you very much. Indeed, again, another rich presentation, I think, with some themes and issues that will resonate through our panel. So it's my pleasure now to introduce to you Louise McDowell, who is Dr. Louise McDowell, dance artist and academic. Louise has been engaged in sort of community-focused work with a view to the kind of stuff that can make a difference to people's lives, to advance their understanding of health issues of the body by engagement in movement and arts and physical activity. Her current research is with the Cardiovascular Sports and Exercise Sciences Department, explores the impact of movement and physical activity interventions on the health and well-being of paediatric oncology patients, younger and elderly people living in deprived communities, and people attending or residing in palliative or neurological care settings. And you have an ethnographic approach, and we heard how kind of ethnography was such an important, I suppose, tool, you might say, or methodology in providing narratives alongside some of the quantitative evaluation, and I guess giving people a voice to express some of the benefits that they may be encountering through arts in a therapeutic setting. So without further ado, welcome you to the podium.
So good morning. Today I will share findings from a longitudinal study which explored the impact of participation in a recreational dance programme on the health, well-being and empowerment of young people living in deprived urban communities in East Leeds. At its heart, the research sought to better understand if and how dance can be used as a health-enhancing strategy for youth who live in deprived areas. A fifth of the population of Leeds are living in poverty, in areas ranked amongst the most deprived nationally, according to the Indices of Deprivation 2010. East Leeds is one of these areas, with over 3/4 of its population living in deprivation. Neighbourhood deprivation is characterised by high rates of unemployment, divorce, low socioeconomic status, and residential mobility. So residents living in these areas experience roughly 4 times the social, environmental, and health problems of people who live in more affluent areas. So we're talking about community violence, poor educational attainment, obesity, substance abuse, and mental health disorders. Already we can see environmental and objective factors that have the potential to affect young people attending the project that I will talk to you about. So studies by Marmot, Adler, and Chen show that people who reside in deprived areas are more likely to have exposure to negative influences on their health and are more susceptible to risky behaviours than people living in less deprived communities. Given as Hansen and Chan advised that adolescence is a time of marked social and biological change and a time when health behaviours are becoming established, it's critical for children and young people from low socioeconomic households to be encouraged to adopt healthier lifestyles by forming activity habits that may serve as protective factors into adulthood. This is why it's important for young people from deprived neighbourhoods to have opportunities to participate in health-enhancing activities that are both affordable and accessible. Early evidence shows that dance plays a significant role in improving the health and well-being of young people by improving cardiovascular health, preventing and reducing obesity, enhancing social skills, increasing mood and self-esteem, and improving physical activity levels, Kim and Kim, 2007. However, there's a lack of comprehensive evidence-based data surrounding the impact and effectiveness of community-based dance programs upon young people who live in deprived areas, as most studies involving youth tend to be based around school-based curricular interventions. And this is where this research seeks to bridge this gap in knowledge, by trying to understand how participation in dance impacted the thoughts, feelings, and behaviours of young people residing in deprived communities in Leeds. The research was framed through Edwards et al.'s adolescent quality of life model shown here. It's a conceptual model that incorporates adolescents' perspectives and language into its modelling. 4 domains are established based on adolescents' evaluation of their social relationships, sense of self, environment, and quality of life, with several sub-themes shown under each category. What will become apparent throughout the rest of the presentation is the scope that dance can provide in addressing many of these aspects. The research I will talk to you today about was funded by Arts Council England and conducted by researchers from the Sports and Exercise Science Department at the University of Leeds in partnership with Yorkshire Dance. Yorkshire Dance has delivered a youth company programme in East Leeds for 7 years. The youth programme is a free, open access provision for young people to attend between the ages of 10 to 19, but we had a 20-year-old who were living in East Leeds, which is the only stipulation. There's no audition process to enter the company, and there's a rolling recruitment policy. Once a week, young people meet at Yorkshire Dance for an 1.5 to 2 hour session, which draws upon contemporary dance practices. In total, during the study, we engaged 57 youth dance participants, and this was split between 2 companies. So a junior company comprised of 23 members, all of them were female, and ages ranged between 10 to 14. The average age was 12, and they attended on average 17 sessions. And the average time they'd been dancing for was 4.5 years. The senior company was comprised of 34 members. 79% were female, and the ages ranged between 13 to 20 years of age. The average age of participants was 16, and on average, these participants tended to attend 16 sessions and had been dancing and had previous dance experience of 9 years. An emergent research design was employed for this longitudinal study, involving both quantitative and qualitative methods. Over a 10-month period, I worked as an ethnographer in an environment I know only too well as a dance artist myself. I collected data on site using formal, in-depth, semi-structured interviews, informal conversations, focus group interviews, participant observation, field notes and a reflexive diary to detail the existing youth dance provision delivered by Yorkshire Dance of both junior and senior youth companies. As you can see from this slide, we amassed a significant amount of data over this 10-month period. I observed 75 sessions, conducted 32 formal in-depth individual interviews, and 4 focus group interviews with the youth company. In addition, quantitative data was also collected at 4 time points through the project to complement the qualitative data in the form of self-report questionnaires, which were used to assess physical self-concept, resilience, psychological distress, mental well-being, and physical activity. This data was then triangulated against impact data collected through self-report questionnaires from a control group and focus group interviews with participant school teachers, parents and carers, and dance tutors, meaning we were able to build a rather comprehensive picture around the participation of dance and its influence on health and well-being from multiple perspectives. So, what did we find out? So, evolving psychologically, socially, and physically, these are the key themes and patterns which emerged throughout analysis of the data. And presented here are the benefits of dance we coded for. So we have evoking positive feelings, dancing makes me happy. Becoming health conscious, improving eating habits and experiencing weight loss, building social confidence and skills. Now this is very specific to the junior company. I think because of the age, they were extremely shy. So having opportunities to have social interaction was really valuable for them because they were questioning their identity, wanted to peer, wanted to find their tribe effectively. Giving and receiving support, fostering peer relationships and closeness, taking charge. Now this was just specific to the senior group around empowerment and could have been based more around opportunities for creativity where they kind of could give their own standpoint and their own sense of opinion. Relieving stress and gaining respite, so my escape from reality, building confidence and discovering physical capabilities. So evolving psychologically through dance, we see a trend towards positive psychological affects and improvements emerging due to participation in dance, which helped young people to experience an improved quality of life, identified through the following sub-themes: evoking positive feelings, building confidence and discovering physical capabilities, relieving stress and gaining respite, and taking charge. An example of this expressed by one young person is, like for me, dance is the easiest way to get it out. Like sometimes I'm really talkative, but then sometimes as well, I'm like, well, I don't want to talk. And I kind of dance and I feel better for it because I've kind of got it out, but not said it got it out in a way. So I think that's definitely good to have, because then you have more than one option. Like I don't have to go to somebody and say, oh, this is the issue. I can sort of dance it and be like, I haven't had to go to somebody. I've got it out and I've sorted it, sort of thing. So here we can start to see like how actually for people who possibly struggle with communication, verbal communication, feel like they lack the vocabulary, dance can provide another language and a means of resourcing that. It can start to problem solve, we can start to resource from ourselves. And it also provides a way of empowering. So for this young person in question, it became a resource for them where it's like, actually, I can do this for myself. And wanting to self-resource rather than always having to go to speak to someone which they were uncomfortable with. So adolescence and adulthood are volatile and psychological times for young people, contending with hormones, puberty, growth spurts, and continual questioning and searching around their identity, sexuality, and seeking assurances about who they are. It becomes incredibly important when working with people from deprived backgrounds to acknowledge the additional stresses that may be occurring for them, and to recognize the rhetoric already existent around perceptions of who they are, what they can achieve, and who they will become based around their backgrounds and where they live. So young people also commented, I can believe in myself and do things I never thought I could do before. Another said, I feel free, I feel able to do things. So Manatel describes self-esteem as not just a basic feature of mental health, but also as a protective factor that contributes to better health and positive social behaviour through its role as a buffer against the impact of negative influences, with Kaplan suggesting that self-esteem is an internal moderator of stressors. The clearest enaction of this through our research findings is identified through feelings of happiness, excitement, meaning and purpose ascribed to young people's lives through participation in dance, leading to improved self-esteem and self-concept. For many members, dance was situated as a means of resourcing ways to counteract environmental stresses, such as exams, hostile living environments, or aiding those with low self-esteem and self-concept by aiding coping strategies for processing these situations through sense-making, emotionally channeling and releasing this through movement, or simply having time out from the situation and providing respite and a way of relaxing. Moving on, I should talk about some of the social benefits that young people experienced. These are the facility to make and build relationships, to feel included, social integration, to build social confidence and skills, give and receive support, and to foster peer relationships. So examples of this are shown through the two quotes here. Once you step through the door, it's like there's your family waiting for me. So we've got one big family. It's like somebody is actually there for me, not at home watching TV. The second, it helps me to feel more included in something. So it's like I feel part of something. So Cohen suggests that social networks provide emotional, informational, and material support that serve to regulate behaviours and offer opportunities for social engagement. The role of social relationships in our physical health, the structure of our social networks, the support we receive from others, the quality and quantity of our social interactions, and our feelings of isolation and loneliness all have a bearing on health outcomes and affect perceptions of a young person's quality of life. Evidence of social support functioning through emotional and informational system types were founded through participants' descriptions of participating in dance, alongside the functioning of social integration, described through feelings of inclusion, being part of something, being a family, feeling cared for and connected to other members and tutors. The facility for dance to introduce and harness ways of socializing and cultivating friendships through the promotion of opportunities to create and problem solve together, equipped young people with skills and ways of gaining confidence socially in and outside of the studio. For members who were particularly shy, anxious in new social situations, or lacking in verbal confidence, this skill building was crucial in enabling modes of engaging with people. Due to the time constraints, I won't have the time to go into the physical and emotional, environmental impacts dance had, but suffice to say, there were many. But we'll move straight into the tensions which arose. So tensions approaches how participation in dance was experienced as complex, resulting in stresses that threatened to undermine youth participants' quality of life. It's important to acknowledge the experiences of adolescence and adulthood happening alongside this participation, and the environmental and life events occurring too, such as GCSEs, SATs, applying for university, part-time jobs, for some members being thrown out of home, being in trouble with the police or at school, being bullied, and the bereavement or ill health of a parent. So tensions which came up in our themes were an increased stress and pressure that was specific just to the seniors, feeling physically fatigued and drained, negative social interactions and interpersonal conflict, and experiencing disappointments and frustrations. So examples of this are shown here. Yeah, because I have a lot of stress just with college work and dance. I'd be like, oh, I've got dance tonight, but I need to do this for college. Then other things like social life and stuff like that just all getting on top of me. Then I just fainted. I don't really want to talk to the new girls because I feel like they've already got their group of mates. And I don't know, I just feel like they don't want to speak to me. So some of the main tensions young people discuss were around boredom, particularly in relation to the rehearsing of pieces once they've been choreographed. Frustrations around newer members to the group resulting in changes in group dynamics, and movements that they struggled to pick up resulting in an I can't attitude, comparisons to be made, and a feeling of exclusion. Members struggled with feeling limited by the movement they can do based on other members' capabilities, physically or creatively, Many felt tired and lacking in energy to do other tasks after dancing, particularly those attending more than one dance provision, which placed an increased pressure and stress on young people around finding time to finish assignments, finding part-time work, and needing to make sacrifices around how they spent their time socially and the need to withdraw from other sports teams or activities. So Newman and Newman proposed there is an adolescent fixation with group belonging and aloneness, calling this a psychosocial conflict of group identity versus alienation, which is supported through the findings of this research. Members of the junior group spoke about not wanting to feel lonely, the need to make friends, and opportunities to get to know one another, and a concern for fitting in. Whilst observations from the senior group were founded around establishing a sense of belonging to the group, forging a group identity, and tensions felt between their desire for individuality versus the needs of the group. In conclusion, findings from this study suggest that yes, participation in recreational dance does enhance quality of life for young people living in deprived communities. Yet participation in dance also has the potential to have a detrimental effect on young people's quality of life too. Findings from this study suggest that participation in recreational dance improves perceptions of quality of life by helping young people who live in deprived urban areas to view themselves and their lives in a way that was more enjoyable, purposeful, meaningful, self-assured, and socially involved. Additionally, recreational dance helps participants to build confidence and physical confidence in themselves, to develop socially, to lead healthier lifestyles, feel safe and cared for, and live meaningfully. However, it was found that participation in dance may also result or contribute to financial and workload pressures, experiences of interpersonal conflict, negative social interactions, and increased level of stress and fatigue for young people. In the drive to promote healthier lifestyles and increased moderate to vigorous physical activity within young people, there is a need to be conscious that the framing of dance as a health intervention is approached holistically, and not solely based on the physical benefits of dance as an exercise and weight loss tool. To do so does not do justice to other forms of dance practice, which have an intermittent level of activity and approach other areas of health. But more importantly, from a critical perspective, there is a need as a sector to promote the unique position dance can occupy in addressing more than just this singular aspect of health, and to concretely say, when framed around quality of life, dance can meet physical, psychological, social, and environmental needs. A key finding emerging from this study has been the psychosocial benefits of dance. There is an importance going forward when approaching dance as a health intervention to promote these as not simply a byproduct of participation in dance, but as an intrinsic feature of its practice, when taught and framed through pedagogical approaches which encourage divergent thinking, ownership and agency of the individual, working as an ensemble, imagination and creativity, working with and through touch, and a psychosocial climate which promotes an ethics of care. A proposition for those here today would be to consider what the psychosocial climate of the dance or arts provision you offer promotes to young people. Stark and Newton note the importance of the psychosocial climate has during adolescence through discussion of motivation and psychological well-being. So ask yourselves, is it a caring, nurturing, task-involving climate that you seek to create for young people? Is it an ego-driven and competitive climate that you create for young people? And now ask yourselves, how might the psychosocial climate I create affect participants' experiences of quality of life? And to what extent do I mediate for this within the provision I offer? Thank you.
So we're going to invite our speakers to come to the front. Just a little late, we're going to take 5 minutes of the break, and really the whole purpose is to bring together and pursue a cup of tea or a cup of coffee. So we're all high tech here. Is this live? Yeah. To press it up, that's great. So I think there were some really important themes there. I thought the papers, the presentations complemented one another really well. I'm just going to kind of start with a few things that occurred to me. really just by way of kind of reminding everybody where we're headed, and then throw things open to the floor for questions. I think there was something through the presentations around kind of access to cultural activities, different autistic activities. A lot of the work points up some of the social determinants of health issues. We heard from Rob at the very beginning, one of his challenges was around inequality. There was something I thought was something interesting around clearly the different outcomes that can emerge. And one way or another, you all covered a whole range of beneficial outcomes, although we heard that not everything is necessarily sweetness and light with some of the projects. I think networks was something that came out. It's great to hear that your pilot project is going to culminate in a network. And then there were some more of the nuts and bolts things about it's not a quick fix. Some of the grinding things around money, around sustainability, and linked to that, what we heard at the outset and all the initial three speakers, was the need to demonstrate the value of return on investment, what we in academic circles refer to, because we're not kind of immune to that, of the impact. So, lots of things that united the papers, but I'll shut up and I'll just throw things open if there are any questions from the floor. Do we have a roaming mic at all? So any questions or observations or just inputs either to the specific presentations or to all of the speakers? Yes, please, in the front row.
Hi, my name is Jo. I'm representing the NHS England Social Prescribing Networks from North West England, but also wear an STP hat for Cheshire and Merseyside. It's an ask really for the panel. I attended an international conference 2 weeks ago on social prescribing, and evaluation and research was obviously the key element. The issue that came up was research hierarchies in terms of that colleagues in the sciences seem to think that they roll over immutable laws, and the arts and the social sciences and more heuristic approaches and some kind of secondary level. What was coming out from the conference was the random control trials, etc., etc., often are not repeatable, but also the evidence base is fairly problematic, and that there were a number of discussions, particularly from social prescribing projects like the Rotherham project, that were asking for more ethnographic approaches. So I'm asking you to go forth and infiltrate your social prescribing network in the Yorkshire area, and I can provide you with contact details, but can I also draw you into a wider discussion? Because we're risking creating silos, and we've got some really wonderful research, and in the meantime we've got infiltrators on the NHS side who need more voices to support them.
Okay, yeah, I mean, yes. Yeah.
I'll just respond to that very briefly. I've just been at a conference the first 2 days of this week, and this issue of randomised controlled trials came up a great deal more than I found helpful in that particular meeting. It's a conference about music, cells and societies, and there's a real therapy and education context there. And actually the one thing that we need to keep in mind when it comes to RTCs is that we're dealing with individuals who are complex, and actually you're right about that issue of replicability, because we're dealing with individuals. No individual is the same. They have myriad conditions that go towards their situation. So it's not an appropriate strategy to be taking, and I would hope that we're well situated to be trying to help and support the work that you're all doing.
Can I answer this? I would also say if we... Does this... that if we had taken a randomised control technique, we wouldn't have had the data that we collected because of the rolling recruitment policy Yorkshire Dance has. So it wouldn't have worked in line with their strategy. Probably 6 months into our project, we had 30 young people turn up. Now, doing an ethnographic study meant that actually we could complement and we could actually bring those voices in. If we had a randomised controlled trial, those voices couldn't have come in. So.
No, just to reiterate that, I think the reason that we went down the ethnographic route, I mean, we interviewed quite a few evaluators, and then Annie, she's somewhere in the audience, was the person that just compelled us the most, because we realised that it was going to give us a data and a voice for what we were doing, where nothing else had. Previous to that, we were looking at scales, we were looking at questionnaires, but actually none of it gave the rich narrative that we needed for the work that we were doing. And in fact, through doing this ethnographically based evaluation, it's given us the confidence to know that our work is having an impact. And I think exactly, I completely empathise with you about the silos, and I really am concerned about that, because in fact, the work that Artlink does, it's very hard for us to attract a health funding, for example, because it is very much about impact and data. And I just think there must be a way of bringing the two together, because actually the work that we've been doing with this big lottery programme has been going on for 4 years. We've got a huge amount of information, but it is ethnographically based information. Do you want to say something?
Any other questions? Yes, please. Let me give you that.
Hi, I'm Chloe. I'm from Contact Theatre. We work a lot with young people, and it's a question particularly for Louise, but might broaden out to the rest of the panel. I'm just interested in, when you're working with the different groups of young people through the dance projects, were they interested in and kind of positive about the fact that the workshops and the dance was having a health benefit on them? Is that something that they were doing it for, or was it more about the art, the expression, the dance itself? Kind of how did that feel to them?
I think it was twofold. For some, the purpose of going to dance was they were bored. For a lot of them, it was bored. They had nothing to do, and it was something to do, and it was somewhere to go. So for one, it was creating an opportunity for them to do something. For others, it was around weight, potentially, that they wanted to kind of become fitter. And around health, just wanting to kind of have more physical endurance, stamina, muscle tone. And then for others, I think some of the impacts were later on. So I think I had the pleasure in seeing people entering into dance with one opinion, presumably around more health, or just for something to do, and then a journey of some dancers who've been dancing for many years. And for them, it was more of an outlet. So it was helping them to deal with challenging situations that was external to the project.
Hello, my name's Anthony, and I've done theatre and education for a long time. It's a question about the artists working with the ethnographic approach, and I was just wondering, that kind of training, that kind of deep observation, has it changed the way you work as an artist?
We've had lots of debates
Yeah.
about that, haven't we?
Yeah, we had lots of debates about it. And in the way, to be quite honest, if I'm delivering the session, I'm in the zone, and to remove part of me as an observer, it's almost impossible. What I tend to do is I kind of ask the other artist to record it in some way, whether the photographs or actual sound recording. And I go, when I'm writing a report, I go over it and it triggers off the memories. And that's the best I can describe it. Because I don't want to remove myself from the session to be the observer.
Well, just to add, really, there were endless conversations about this, and initially we asked artists to do a report every session, and then over time we reduced the reporting time, and what everyone finds their own way of doing it. So as Milena says, that's been a common theme. So what some of our artists would do is straight after the session just have a debrief and sit down and immediately come up with the responses to the session. Some would record it, some would note-take during the session and take it in turns. So it's about developing a way that works for you, and that has taken time. You know, we're now in the 4th year and they're all incredible ethnographers.
So we are going to have to curtail things. If you join me in thanking all of our speakers for a great session.